Stuck? In the past 6 months, I've seen far too many articles asking if patients should be even allowed to see their health records. There's a debate that continues that asks, what parts do they own? What parts do they update that we're not moving forward? And as a result, I want to put this in context and actually take a step back and share a story first. And it's a story of outside of health, in the world of education, of a character named James Buckley, and something called FERPA. So back in the 60s, and any time before that, if you were a student or parent, it was impossible for you to get access to your own child's records. That means you couldn't see grades, no teacher comments, and no counselor notes on why your child was misbehaving. This was pretty unhelpful to parents and students because you couldn't see what you're doing wrong. But more damaging was those records were being sent to colleges and universities and even employers full of mistakes, factual inaccuracies, and even prejudicial anecdotes. And so this damaging thing would ruin people's college careers. And as a result, in 1974, Senator James Buckley from New York introduced a bill into the House that strengthened the privacy rights for students. And it was called the Family Educational Rights and Privacy Act, or FERPA. FERPA ensured you as a student could see your own records, that you could update and make, amend if there are any mistakes in them, and you could decide which schools they went to. Opposition to FERPA came from counselors and administrators. They said that if students could see the records, that it would harm them, and not just that, it would also, parents and students would start to misinterpret them. Buckley and proponents rejected this as unfounded and as well as hypocritical, because those same counselors and administrators were releasing them to third parties already, to companies, to universities, and even to law enforcement. So FERPA passed. And as a result of FERPA, we have this student bill of rights that lets me say, and look at my student grades, lets me pick the universities they go to, as well as if there are any mistakes, I can catch them before they get sent. Wouldn't it be great if a similar bill of rights existed in health? One that would push us past this debate of whether we do or do not get access? That we as patients, as participants in the healthcare system, can view our own records, correct any mistakes if they exist, decide which third parties and external parties get them, and most of all, get a copy for ourselves. Wouldn't it be great if something like this existed? Well, it does, and it's called HIPAA. HIPAA stands for the Health Insurance Portability and Accountability Act, but unfortunately over time it's been radically misunderstood as this evil, limiting thing, when in truth it's actually the protector of patient rights. If you read into it, it actually says that patients have the ability to view their own records, correct mistakes if any exist, decide who gets to see them, and most of all, get a copy for yourself, whether in a physical form or because of the new HIPAA mods, in electronic form. But like all Bill of Rights, our rights are not actualized unless we assert and exercise them properly. And so it's the responsibility of all of us here to make sure that these rights are more meaningful. And it starts with patients. Patients are allowed to ask for access to their own records. And if for some reason someone doesn't give it to them, there's a letter written by the Office of Civil Rights at HHS that says it's your legal right to get one. But a lot of work is also being done to ensure that there's easier ways to get access. Because of a lot of the great work of EHR vendors, the larger health IT community, and the leadership of HHS and the Office of the National Coordinator of Health IT, many of us will begin to get our records electronically. And of course, it's going to start with those that are receiving EHR incentives, but that's 2/3 of office-based physicians and 85% of hospitals. Patients are going to be able to get their data. But it doesn't stop there with patients. Doctors and nurses also want patients to be more engaged with their health information. Pills alone don't cure obesity, heart disease, or any of the chronic conditions that plague our nation. It requires patients to be more aware of their condition and care plan. Unfortunately, there's media that makes doctors look like the bad guys, right? Saying doctors don't want patients to have access. But when you dive in and you actually look at the source of what they cite and you look at what they say, 82% of doctors want patients to actively participate in this electronic health record world. We're making progress. And so when we all begin to collaborate, right, doctors, nurses, patients, and even designers and developers, a beautiful world starts to get created. So we know that health records are really hard to understand. So one of the things we did is we asked the entire country, the designers across them, to help us redesign a record that was easier for someone like my mom to understand or someone like my grandma to understand. And what came back was 240 amazing designs that were featured across the internet. And what these designers did was take the record that gets printed out of a health system and turned it into this, and this, and this. There was a group of developers at the VA and California Healthcare Foundation that were so inspired that they created a framework. And a framework is this little piece of code that took that printed record and turns it into actually this, a more beautiful, understandable, and easier to use health record. And so the neat part is that entire showcase, as well as all this code, is made available in the open source. So anyone here, anyone listening, any EHR company, feel free to borrow, steal, take, remix, adapt on these ideas because they are ours and all of ours. So. And it doesn't stop there. Developers can also strengthen this Bill of Rights by creating more impactful and meaningful healthcare applications. Too many of consumer apps failed because it's so hard to get data into them, right? Consumers have to enter information to them every single day. Google Health was an idea before its time. The reason why it didn't live up to its full potential is that it was so difficult to get data from hospitals, pharmacies, and doctors' offices into their application. But there's a fix for that. And it's something new, and I want you all to support it, and it's called Blue Button Plus. It's a way to securely get health information from EHRs to third-party applications. With this technology, there's no better time for consumers to be more engaged with their health and for developers to create some amazing applications. And so to close, I would like to say we're not stuck. We have the tools, and we have the rights. And so with this room, we also have all the talent as well, too. So now it's up to us to push forward and do amazing things with patient health data. Thank you.